safety. Thank you, Governor. Thank you, Governor, for your leadership role in advancing this important discussion we, as Maine, need to have regarding acting upon the cancer that is in our communities, that impacts families, newborns, children, young adults, property values, and businesses. No area of Maine is immune from drug trafficking and its impact. MDEA's task force approach provides a central administrative structure for the establishment, coordination, and oversight of specialized narcotics and narcotics-related investigative units within the state. Its goals are to disrupt illicit drug markets by investigating drug distributors and/or drug trafficking organizations. It undermines the drug suppliers to meet, expand, and profit from drug demand, while also supporting prevention efforts and contributing to treatment efforts. It broadens awareness as to the trends, threats, myths, and consequences associated with illegal drug use. The task force approaches have a significantly higher proportion of high-quality trafficking investigations than departments acting alone can achieve. State, county, local, and tribal departments simply do not have the personnel to assign full-time officers to a task force. The legislature recognized this, the threat to public health and safety, by creating Maine DEA to focus on drug traffickers. Both the volume and the complexity of investigating drug crime has increased. Maine is subject to ever-increasing numbers of out-of-state drug trafficking organizations establishing drug markets in the state. And they're also involved in other criminal activity, including human trafficking. Methamphetamine lab-related incidents have risen from 6 in 2001 to 20 last year. These incidents typically the cost exceeds $10,000, impacting safety and property values. Drugs is the common denominator that is driving other crimes, including murder, robbery, burglary, and assault. But we also cannot overlook the human damage drug suppliers are sowing, all in the name of money. The number of drug-affected births has increased over 500% since 2005. Drug-induced deaths has increased over 400% since 1997. MDEA staff of under 40 full-time assigned officers is insufficient to combat the drug traffickers throughout Maine. This has been unchanged for years, while the drug trafficking problem grows worse. The governor's proposal strengthens Maine's task force as one element necessary in the effort to control drugs within our border. As the governor remarked, there is no single silver bullet to addressing drug abuse. This is one step towards that goal: enhancement of efforts to identify, investigate, and prosecute those that distribute drugs within our state. We in law enforcement, Colonel Williams, Sheriff Liberty, Chief Crowell, and Chief Massey, need this focused resource to better protect our communities. Thank you.